Resilience in healthcare, both personally as well as in your practice. That's what we're talking about today. Hello, I'm Marinda Nelson. I help healthcare providers and physicians and leaders in healthcare love their work again. When we help you love your work again, then you get to be the provider and physician leader that you want to be, and the patients, your colleagues, your staff members, and you all benefit. Resilience is a big topic in healthcare right now. So we're going to talk about what is it that we're wanting with this idea of resilience. What actually is it? What's out there now? What are they saying now? What I see, which is not what you keep hearing around there. And then how I train my clients to have resilience and eliminate burnout in their personal lives as well as in their practice. This is a very related conversation. Words, while they are not the same, portions of resilience and burnout are similar. So you may hear me use those words back and forth. Now, I am having this conversation from the hotel room that I have been in the last few days as I got to practice my resilience for the first time in 25 years off-roading. I hit a rock and damaged my car, and it needed to be towed, and it was in the shop, and then they got it fixed, and then they needed to fix it again. I have been so grateful that I have the resilience and I have this space in my life, physically, financially, time-wise, emotionally, mentally, spiritually, all of these things, that I'm able to navigate this. Yes, there's been frustration and sadness and some plans that had to get shifted around, but also with gratitude and grace. Okay, so I am having this conversation from a place of getting to practice my resilience. When I say they, I mean established healthcare. They describe resilience as the ability to adapt well in the face of trauma and adversity and significant stress. This idea of being able to bounce back more quickly, more effortlessly, and continuing to move forward rather than being totally overcome and just hitting the bottom, having it be the straw that broke the camel's back, or hitting the wall, or hitting the rock, or any of these phrases and descriptions that we use. Burnout, this is where that fits in. The list for developing resilience and bringing resilience into your personal life as well as your practice, they had 5 categories that they broke this into. One was developing connections and friendships with colleagues and loved ones. Wellness ideas. This is our self-care wellness, eating well, working out, taking the supplements, doing the things, having purpose in your life in healthcare. This is an easy one for us. And embrace helpful thoughts and a hopeful outlook. This one in healthcare gets to be a struggle. And this is another place where burnout comes in. So we're going to be talking about these things and then seeking help when you need help. These are vague, generally not helpful ideas. The establishment does not actually want you to develop resilience. They don't want you to do it. You know why? You are less in survival mode, you are less stressed out, and you are less manipulatable when you have more resilience. But also the flip side of that is that they want you to keep going. They want you to keep doing more with less. So if you can keep doing more with less and not get burnt out, then they can keep utilizing you to the fullest. Yes? Here's what I see. You are resilient. You are crazy resilient. You are one of the strong ones. You have overcome and overcome and overcome and pushed and served and depleted and pushed and served and depleted. You are so resilient. You are doing an incredible job. You give and you give and you give I see that you are too resilient. You have this tough, independent, gonna do it, gonna get through it exterior to protect this soft, deeply caring interior. You want to keep going. You want to keep giving. You don't want to let anybody down. You want your effort to matter. It does. I'm telling you, it matters so much. Your resilience is what you've been doing your whole life. The strong ones get tired. And it's okay to say you're tired. It's okay to put some of this resilience down. Your worth, your value does not come from how much you can deplete yourself. I know that's what you are taught. I know that's what previous generations believed. It is not true. Whether you see 5 patients in a day or 50, you are still an incredible physician or provider in healthcare. It's okay to say, no, I'm not going to be triple booked. It's okay to say, no, I'm not going to take that extra shift. Resilience is not running balls to the wall all the time. Because when we run in survival mode, in depletion all the time, then any little thing is enough to put us over the edge, is enough to downward spiral us. Resilience is creating this space where you are serving from your overflow, where you get to be the sensitive and caring and compassionate provider that you want to be, where you are protecting and providing for your mental well-being, your physical well-being, your spiritual well-being, your emotional well-being. Now, this is going to require some doing on the back end. They probably don't want you to do it, so they're not going to be lining up trying to help you do this. And this is what I help you do, is develop the systems and structures behind you so that you can provide for and protect what you find important, what you value, the way that you want to be a physician or a provider, so that you have the financial backing so that if you need to part ways from your current position and start your own thing or find a new partner or a new practice to work with, that you can do that. Resilience is being proactive, is taking that responsibility for your well-being back and saying, this is what's important to me, this is what I do, this is how it will be, and committing to creating that. That's precisely what I help you do, is creating the space where you can serve from your overflow. When we do that, we're able to give more. We're able to give and give and give and give without it depleting us. So you can not only give more, you can show up and do the good job that you want to do. Not because you need to save them, but because you love showing up this way. You get to love your work again. And that means setting your standards and setting your boundaries and providing for and protecting what is important to you. Establishment is not going to like it. They can talk about it. Oh, they want to talk about it. But they want you running ragged. They want to staff so lean that one person not showing up is going to compromise patient care. They're okay with that, even if you're not. That's what resilience is being proactive enough to say, hey, if somebody needs to call out, we want one more here to help us. If we have an emergency, we're staffed and we have the space. I have the financial backing to do what I need to do. I have the space in my schedule to breathe and to handle whatever may come my way. Where one thing isn't going to create a downward spiral, isn't going to put me completely over the edge and completely burn me out. Now, I help my clients a lot with burnout, and here's what we focus on. What do you love? What part of healthcare do you love? Is it the moment where they take their bandages off and realize they're going to be okay? Is it the moment where they realize that you actually want to listen to them and work with them and truly help them? What is the exact moment that you love? What is it that you feel like you're having to not care about that you deeply, deeply do? And be specific with these things. What is it that you deeply, deeply care about that you're feeling like you can't care about? Now, I want you to think of what is the smallest actions. There's reasons for this, and I go into this deeply in other trainings. What is the smallest thing that you can do? Is there a high yield savings account that you can set up? Is there a phone call that you can make? Is there a committee you can decide to be involved with? Is there a committee that you're going to come off of that isn't serving you and your goals anymore? Are there extra days or clinics or hours that you can say no to? Are there PTO hours that you can utilize? Is there programs on mindset that you can find help with? I have those for you. Let me know if that's something that I can help you with. Do you need to start talking to a therapist? Is it time to have some help outside of you? There are so many things that we can do, and I want you to break it down and make it as small as possible. Yes, we want to change healthcare tomorrow. And putting yourself in that burnout cycle of dismay at how bad it is, defiant because you're going to change it tomorrow, feeling defeated when you can't change the entire system tomorrow, that doesn't work either. So we're going to break it down. You're going to focus on one tiny thing, on one moment that you love. Maybe it's seeing your staff laughing and feeling like they had success. What is that moment that you would love? And what's the smallest thing that you can do to bring that about more and more and more? Where can you create space in your practice and in your personal life to begin to give yourself some space to breathe? You are resilient. You don't need to develop it anymore. You get to set that to rest. Now, it's going to feel lazy. It's going to feel too easy. It's going to feel boring at first. And it is into those spaces that when something comes up, you have the space to navigate and to handle it with grace. You're already doing it. So it's time to put some of that down and start taking care of you. We'll talk to you soon.